The primary role of a legally authorized representative, or LAR, is to serve as a surrogate or proxy decision maker. They provide informed consent when participants are unable to provide or no longer able to provide informed consent. Even when participants lose the ability to consent to a complex research study, they often retain the ability to appoint a proxy decision maker because this is a much simpler cognitive task. Consenting to a complex research study requires learning and retaining a lot of new and technical information. The decision to appoint a proxy involves trusting someone else to make a decision. The choice of a proxy is often based on existing close relationships. A majority of older adults and adults with Alzheimer's disease support the idea of letting an LAR make research decisions on their behalf. So let's talk about some ways you can help your participants appoint an LAR. In an earlier video, we discussed when involving LARs in research studies is appropriate. If you decide to discuss LARs with your study participants, here are some steps to guide you. Step 1. Know your state laws. The Office of Human Research Protections suggests that anyone who can serve as a proxy for healthcare decisions can serve as an LAR for research decisions. But they also recommend that you follow state law. Very few states have laws that address appointing an LAR in research. Ask your IRB or legal counsel if your state has any laws regarding appointing LARs in research. Step 2. Initiate a discussion about LARs. Discuss with the participant who they would appoint as an LAR if their decision-making ability becomes compromised. We've provided our optional talking points document on the ConsentTools website that provides suggestions for things to say when discussing LARs with a research participant. Step 3. Document the discussion. Document discussions of the participants' preferences regarding an LAR in research records. Check with your IRB as they may have templates or suggestions for appointing an LAR. We've provided a note-to-file template to document discussions regarding an LAR if your IRB doesn't have a preferred form. This template can be adapted. Finding an LAR may not be easy in certain circumstances. Some patients lack decision-making abilities but have no one readily available to serve as an LAR. Contact your IRB for guidance on how to handle these situations. Check out the ConsentTools website, where we've provided further materials to help you involve LARs in your consent process.